So, introduction to our listeners. My name's Chelsea Larkin. This is Libby Cameron. We're owners of True Regenerative Healthcare. Libby is an amazing medical director that's been in regenerative medicine for, the last 10 years, and she's been in medicine for 20. And today we're going to talk to you a little bit about longevity medicine and what that means.
Well, I love the sound of that. Thank you very much.
Yeah, she's great. She's very modest, but she's amazing. So longevity medicine, what does that really mean? When we think of longevity, is longevity because we want to look good? Is longevity that we want to stay 18? Or is longevity the definition of aging with quality and quantity versus quantity without quality?
Well, that's an easy answer. You're not even making it hard today. I appreciate that. Thank you.
Yeah. But just for our listeners, when they're contemplating that and they're thinking about those kind of things, that's a real thing. That's a real thought, because longevity medicine is here, right? It's here.
Yeah, it is here. But I think most people either want to look back, or maybe they're brave enough to look right in the present. But I think longevity is a hard conversation to have with people, partly because they think that the die is partially already cast. Things are going to happen like they're going to happen. Most people understand that lifestyle will make a difference, that they can improve the quality of their life, by eating a little better and whatever. But I think they way underestimate that value. They underestimate the difference in how they feel. And it's just because that's been what they've known. And to contemplate living a long and healthy life, that's just something that you say, but I don't think people really think about it. They don't plan for it. Financially, we're all worried about retirement. We've got retirement plans, and we'll talk about, retirement goals with our friends. But as far as longevity, you don't hear people talking about, well, my goal is to live till I'm 85 and be totally independent, not ask anyone for help, and be financially secure enough to travel. That's not the conversation that you hear.
Well, I think in the younger generation, I can tell you from mine being a millennial, they do talk about how they don't want to retire and be, going down in this nice little boat and passed out and tired, because they're so tired because they retired, years and years later, and they didn't take care of themselves. We see that, we don't want to be our grandparents, and we don't want to be our parents sometimes. We're starting to see chronic illness with our parents. And so that is a conversation I think the younger generation is having, where we're like, please do not make me be like that. Like, I don't want to be crippled when I'm older. And then when you start seeing things like memory decline, those things are scary. And I think it's scary for my generation too, because they feel that already. We're starting to see, people in our generation talk about brain fog and fatigue. And I think that's why it's triggering so early on now versus, conversations maybe in your generation at our age, right?
Absolutely. I feel pretty strongly about what you just said, because you were kind to say I'd been around for the 20 years, but I've actually been around a lot longer than the 20 years. But, it is 40, and it's okay. I don't mind saying that. But what I see different is, when I was a younger person, I didn't see as many people not feeling as well. Now, when I look at 30 to 40-year-olds, I see a lot of chronic disease already in play. It has not incapacitated them. I'm not trying to say that, but I see the footprint of it in how they express themselves, as far as their energy levels and their ability to think quickly and problem solve and, handle the stresses of everyday life, and it's hard for me to just pretend it's not happening. Mm-hmm. And the difference really at this point is not so much straightforwardly genetics. Some of it definitely is lifestyle choices, but the other part of that is our chemical environment, what we're eating, what we're drinking. It does not have the nutritional value. We have a lot more opportunities to get heavy metals in our body and and phthalates and just all kinds of chemicals that just were not in the environment to the degree that they are now. We've watched, endocrine disruptors get into the milk supply. I mean, even in my lifetime, the average menstrual cycle for girls started about 14 when I was younger. Now it's 11. For boys, you didn't hear anybody talking about low testosterone at age 20, but I've actually seen quite a few young men with lower levels of testosterone, and that's simply because there are endocrine disruptors that are in the environment. They are eating it, drinking it, and it is changing their hormone signaling pathways in the body, and they are seeing hormone changes earlier. So I think that you guys in the younger group are probably smart to maybe talk about this more. I know in my generation, it's a lot tougher about. It's to even talk about, to try to get your parents or grandparents nailed down on what it is they want for a funeral. That's a tough conversation. So to try to get them to talk about, well, what are you willing to do, to stay healthy now today? And they're thinking, well, my life's already over. What difference does it make?
And that a lot. I hear that a lot from patients is they don't understand the value of themselves at this point. You just may as well rule them out. They're done. So all the pain and sun, and they're chirking back. Yep. And that's just simply not true. And it makes me sad that we've created that in medicine, that we've created this idea that the older that you get, the less valuable you are based off of the way that we're treating patients, where at this point it's like, well, this is just part of age. And how many times I hear that is, well, you're aging. But what does that mean? What does that mean when we're aging? And how does that tie into longevity medicine?
Well, I enjoy it when patients come in and they tell me, I'm getting older, because I'm sure in previous generations it was the physician or the provider telling them, you need to think about your age. But in reality, everybody already does that too soon. And I will tell people quickly, your lack of energy, your weight gain, your brain fog, none of that has to do with your age, because I can show you 80 to 90-year-olds that are fully functional and can work circles around you. So this is not an age problem. This is a problem within your body, and we need to take care of it. And we can turn the clock back on all of those things. And if I can get them just a little bit invested in themselves, then I think that they will make a commitment to move forward. I have noticed that when we get patients in and we're talking to them, if we set up a plan, and even in my own mind, I'm thinking in 6 months to a year, I want to do this. But the very first thing on my list for them is, how can I get them feeling better as quick as possible? Because through feeling better and having energy, they'll be excited to take the next step. Because for some of the ones that come into the clinic here, it's almost like, well, I don't know what else to do. Nobody else has been able to find anything. They all tell me everything is fine. So it must be just age, and I'm miserable. I don't want to take all these pills. I don't want to be a burden on my family. Is there anything that you can do for me? I don't want to hurt every day. And then as we start down that road of turning things back, and all of a sudden they don't hurt, and they can separate the hurting from that perception of old age, all of a sudden they're very excited about let's move forward. Because if this is not age, if this is really things that's within their power to fix, if they just need a guide, then they're all for it. And that has honestly been one of the most wonderful blessings that I've seen in the clinic with you, is that we've taken patients that honestly, they literally were on their last hope and prayer. And then to see them, they're like human dynamos, and it'd be uplifting.
It does a lot for us. Well, and even create value for them, even our patients that are still on the journey right now, it's reminding them that they're valuable, because the way that we value things now, like a new car or a TV or a house and all these physical things, and you are, in my generation or my age, they may not be things where we're thinking about how we're feeling or how we're aging. Like I said, we talk about it more, but until it becomes a crisis, what's the investment worth? What is the value of this to me? And that's what I've noticed too. And just the younger patients that we have, they are invested when they're chronically ill, right? And so when we're looking at longevity medicine, they're in crisis medicine at that moment. And until we get the crisis taken care of, longevity medicine, I mean, that's part of the longevity plan because we got to put out the fires, right? We got to,
Absolutely. Absolutely.
but we also have to create value to that because they've been chronically ill for sometimes some of our chronic patients have been so sick that they feel like a devalued human being. They feel like a burden on their family, even younger. You're talking about, older people talking about this, but just all of our patients, especially the people that have been sick, they feel like their value is just lower because they don't bring enough to the table. And I love that part where we get to turn that around and make them feel heard and seen and valued, and watch their journey and watch them blossom into this person where they do have energy and they feel more valuable in return. They get to be valuable to their families. They get to be valuable, they feel more valuable to their children because they're better parents. And you start seeing them bloom and go through this. That's longevity medicine. That is what that is we're watching the quality of their life come back. And you can do that for longer durations of time. And that time is real and that's here. And I think that's the point we're trying to get across, is that it's not something in the future. It is right here. It is now. We have so many things at our fingertips. And I mean, tell them some of the things that you're starting to implement now that you couldn't have done 10 years ago.
Medicine changes so quickly. We've had that conversation. So to ask that, a 10-year period of time is most hard to be able to give a whole long list of things. But
a lifetime ago, it was a lifetime.
Exactly. So how about, the last few years? Instead of a 10-year timeline, from the genetic standpoint, we can actually see the genetic code. We know now through epigenetics, which is essentially putting things in play in the body that will turn genes on and off. So it is a way for us to develop workarounds around those things that genetically we kind of got stuck with. 5 years ago, we understood those pathways were there, but we did not have great ways or ideas of how to move around it. And that I can honestly say, especially with the methylation cycle and with detoxing, we know a lot now of how to get people's bodies to work better, even though there's been a little bit of a genetic challenge. And so that's been huge to identify root causes. Now, even 5 to 7 years ago, root causes were pretty much categorized almost into the basket of hormones. And usually it came down to menopause and changes in estrogen and progesterone, or in the men, their testosterone has started to drop off. And we talked about how to make things better for them, because we could actually then intervene with bioidentical hormones and get that better. What providers didn't do as well as they should have is understand how well just that one hormone system actually connected to all the other hormone systems. Because once we start seeing hormone changes in testosterone and estrogen and, those midlife sort of times, it's almost like the first nod that, age is happening. But in reality, age started 10 years before that, because we began to see that discrepancy between insulin and glucose being stabilized, and us being able to use insulin glucose effectively. That was actually our first step down that longevity, worsening health road. But we don't recognize that. That's just a weight problem. But now we know that actually all of those hormones actually talk to each other millions of times a day. Every hormone system tries to hold the body in homeostasis. Each one has its primary driving force of what it's supposed to be able to handle. But if one hormone system begins to falter, then the other hormone systems try to step up and bridge the gap. One example of this, go ahead.
I was going to ask too, so when we're talking about cofactors and energy, because you're talking about talking to each other, and on those things, they're self-preservation. So where you need specific things more that are crucial for surviving, that's where those energy sources go, right?
Exactly. They do. And the problem with trying to think about of us in terms of this person that operates with heart and lungs and kidneys. It's as if all those systems work independently, and they really don't. The whole body's goal is survival of the entire being. So when we start to look at why we age, you can be assured that there are multiple factors. And in today's medicine, we have an ability to measure a lot of those factors and see where some of the miscommunication or misfiring is happening. And we can already start to be able to intervene and prevent you from going down that road. We talked a little bit yesterday about optimal lab values and what that really means, but that's what that is. It's like when somebody has drifted away from their optimal in a hormone, the question as to why should be, of course, the first one asked, not how can I replace that hormone? Because it's not about just replacing. Replacing is the easy part. Why did it falter to begin with? And if we can understand that, if we can look down underneath the surface to find out where the faltering steps are occurring, then we actually stop that from ever happening in the first place, or we turn it back. And yes, hormone replacement or thyroid replacement or adrenal gland replacement, all of those things are pieces and parts of what we can bring to the table to get people well again. But until we recognize that they are a symptom and not a cause, the quicker we begin to understand that we operate as one whole human organism, and we can determine things to do. Some of the testing modalities that have come up is now being able to show us on a deeper level what our immune system is recognizing as a problem, what our respiratory system, how it's managing its burden and load, because we're seeing a whole lot more allergies and asthma now than 25 years ago. And some of that certainly is the environment, but unbeknownst to people, if you're a little overweight, you trigger asthma quicker. You are, if you have some leaky gut, then you've got some food and chemical sensitivities. And you live every day and you don't understand that that's actually happening under the surface. All you know is one part of the day you feel pretty upbeat, and the other you're kind of irritable and agitated, and then you're exhausted. And there's never been a way of stepping back and saying, these aren't just mental health issues. These mental health behaviors, a lot of those are coming because of chemical imbalances in the body. So our first thought is not to give somebody an antidepressant or an anti-anxiety medication. The first step is to step back and say, what's happening in the body? You're not able to manage your response to stress in your daily life, because one of your major systems is faltering. It's having some struggles. And if we can identify that and shore it up, you don't have to do that.
I love that, because I hear so many people outside of what we do in the clinic and in the clinic talk about anxiety and depression. And they've talked about their experience with other providers and hospitals. And it's always just take an antidepressant, put an anti-anxiety medication on it. And they get so uncomfortable with those conversations because they're like, there's really something going on, and they're getting blamed for not having mental strength to be able to control the depression and the anxiety. But this isn't a mental strength problem. Depression, anxiety, no, biochemical. There's a lot of biochemical issues that come along with depression and with anxiety. And I love in our clinic that we provide a safe space for that. We provide a safe space for people that could be considered a hypochondriac in other clinics. We invite that because every detail of what they're saying tells you a story. It tells us a story about what is going on with that patient. And the more hypervigilant they are, the easier they are to treat. But the ones that we consider the warrior gene, Libby, those ones are the ones that are really difficult because they don't feel anything. So that's back to longevity medicine. Just because you don't feel like you're having any issues, it's really nice to get data markers on yourself to understand where you're at in your health, where your risk factors are, because you can intervene early. And the earlier you intervene, the better it is. We talk a lot about chronic patients, but we don't talk a lot about patients that don't have symptoms and just want longevity medicine and prevention. And that's our preference, because it's easier to deal with a patient that wants preventative medicine because we can go through and show interventions. A chronic patient, when they're already there, it's a lot of investigation, a lot of data collection. And that's the difficult part, is the data collection and figuring out what's going on, going down, those roads, trying to figure out what's going on with the patient, and then getting to the longevity piece of that, right?
It is. And for the patients that come in that state, what I've enjoyed about this process, I think, is identifying for them that mental illness is also a symptom. It's a symptom of something being out of homeostasis or out of balance. And believe it or not, neuroinflammation and gut inflammation are at the crux of so much of that. I mean, finally now I'm seeing studies that relate to how leaky gut and irritable bowel actually sets people up for major episodes of depression. Now there's multitudes of studies out there, where before that it just wasn't there. People suspected it. Now don't get me wrong, there's some really, really smart people out there, and I have enjoyed learning so much from them. To suspect something and then to be able to prove it at the level that it would push an insurance company or a funding source into covering it for everybody, that's two different things. And so we're still in that part of the journey where we're just kind of slogging through and fixing people one at a time. But eventually that knowledge will become cumulative, and it'll be the next step forward in us being able to take better care of people.
So if insurance companies, they don't cover this, and medicine changes so rapidly, why can't they stay on board? New labs, what prevents them from being able to cover all these things if it's beneficial to the patient?
Well, because their focus is on a short-term relationship with an individual, a contractual relationship. You pay us this much money, and in return, if you get ill with these things, and they're pretty well spelled out between the chronic things and the emergencies and what x-rays they'll pay, and they spell out that contract. But understanding that is a short-term contract, that is a 1-year timeline, and they're not going to invest financially because people don't want to pay more. Of course, nobody wants to pay a higher premium, so keeping the premiums low is important, but then that drives keeping the cost of what you give to people low, which means we're always operating with 10 years ago medicine. And that can be frustrating. It's not that it doesn't have value, because it truly does. But at the same time, it's hard when you're progressive to know that there are valuable things out there, but you can't reach for them for everybody. But I think as people have become more educated, I've enjoyed talking to people and seeing, because especially some of the sicker ones, they've done a lot of education on their own. I've gotten tickled when I've listened to them kind of tell their story about going to this office or that office and thinking, well, I knew as much as they did. And it just made them feel more empowered and made them feel like they were at least advocating for themselves, but they were still kind of lost. It's like, okay, so what else is there out there? And longevity medicine and longevity medicine offices are going to be one of the places that's going to be able to offer next step or next level medicine for people, because our platform is not built on it's a 15-minute appointment and I get paid $37 for this appointment. And so only bring up one problem because that's all the time we have to deal with it today. And so just kind of how we've structured makes it more balanced. A patient can come in and we can talk about their financial resources, and then we can say, okay, so within this scope, this is what we're going to do right now. This is the priority at this minute. And we may plan out things for quite a while out into the future if that's what we need to do. And I don't mind doing that at all, because it should not be about insurance or not insurance. It needs to be about whether people are willing to look at themselves and say, I have value. I'm willing to put some work into this. I will eat a little differently if I think that's the best thing. I will change my movement or exercise habits and patterns if you think that that's going to make a difference. And then the onus is on us when we institute those things to be able to show them absolutely and without any question, look at what you've done because you put this effort into this. This is how much better you are because of it. And so it holds our feet to the fire too. And I think that's an important piece because it is a two-way street.
No, it definitely is. And cash pay definitely is around value. It is hard to financially invest that out the gate when you're first going to a clinic. And I can see how any patient that comes through the door, especially if they've been to other providers like you're talking about, where they've went to other offices and they're like, oh, I know just as much as they did. Sometimes it's really difficult to be able to distinguish if this is going to be valuable to you or not. I've seen that along the way. So when you're coming in and you're paying cash, the value of the service that we're providing in our office, I feel like we've gone above and beyond in that sense and made sure that we're really prioritizing patients with the time that you're talking about. That's why we don't take insurance, is because they do dictate the time that we can spend with patients, which doesn't allow us to explore the data properly, to understand them properly. So insurance is not a thing in our office, and cash pay can be hard. And, as other people are learning, I always like to commend the providers that are coming up and trying to learn integrative ways, trying to learn, other ways of taking care of patients. But patients shouldn't be at the expense of that either. So the implementation from other providers, sometimes it can deter patients from trying this type of medicine or believing in longevity medicine as well.
No, honestly, I think as a healthcare profession, we've squandered some goodwill. We have definitely violated patients' trust, since that we've allowed outside forces to dictate what the relationship is between the provider and the patient anymore. I mean, we would do things or not do things based on a third party's, arbitrary rules. And then because patients didn't get better, we're all frustrated. But at the bottom of that is a patient who no longer trusts that the healthcare system is to be able to put them first. And so, we've got some repair to do in that area. And that's just part and parcel of what it is we have to face when we go forward. We have to.
Well, that's patience here.
Yes.
We've provided patience. Every staff here understands that tears happen. Patience is important, that we hold a lot of hands. We reassure, we go over the same thing over and over again. We make sure that they understand what they're doing. We've set up a structure that they can understand what sequences we're doing, why we're asking for things. I think that that's how it should be. They should understand what they're doing. They should have enough information to make an educated decision. And I think we've provided that in our office pretty well.
I do think so. I've tried to tell patients, even on a first or second visit, that my job is to work myself out of a job. That in essence, my job's to teach them. And yes, there's new stuff coming, but as we teach them how to look for that have value to them. I don't ever want to be in a position where if something happened to me or I went on to go do something different, who knows, that I've let people down. But if I've taught people how to take care of themselves, that's teaching a man to fish, right?
Can you really see yourself anything else?
No, I don't. But I throw it out there because we can all get run over by the bus at any time.
Yeah, you get your concept, but she's not going anywhere. Don't let her lie to you. This is her. She sleeps with research papers. Okay. So let's just be real.
I do. I'm not in a hurry, but I'm just saying I don't want people to be dependent on a person. I want them to get connected in a system that looks out for them. And I think that this model is much more inclined to do that.
No, I love that. And we've talked a little bit about Libby's history because she's taken a lot of extensive education to be where she's at right now, to be able to treat patients the way that she treats patients. she's done a lot on her own. There wasn't just an educational structure that just led her through this and guided her through how to do all of this. It takes a lot of effort and time to be able to do what we do here. And before this, about 10 years, I was consulting, teaching providers how to look a little bit deeper and how to explore genetics and realize that genetics, lifestyle, and environment, those three pieces, those literally drive every disease. So if we can understand that they work together, that we could see a patient a little more clearly and have better, treatment modalities. So it's been amazing working with Libby Cameron because she has a slew of knowledge. I've worked with a ton of different providers, and working with her really has made me realize that every 22 days that medicine changes is real. And those research papers on her bed, she teaches me every day, and we bring new treatments and new innovative therapies into the clinic all the time, which kind of makes my job hard because then we have to implement it right, make sure that there's patient safety, make sure that the staff knows. And so we're always changing and growing. And I appreciate that so much about her. And I appreciate our staff so much for staying on board with being able to go through the changes. And, and patients also appreciate it when they come in and realize that we're open to new things. And then if we don't know something about a patient, we're going to learn about it. We're going to learn how we can implement different plans. If there's certain things that we don't have protocols for in the office, it allows us to grow, which is part of the puzzle. Part of the reason why I said she's not going anywhere is because this puzzle is her life, right? Being able to sit there and know a patient and go through the little puzzle and explore that and allow them to come out the other end happy, functional, better quality of life. I mean, there's nothing better than that we could provide to a patient or a person. So it's really rewarding on our side as well.
Well, I wasn't kidding when I said I know there are a lot of smart people out there, and I know a lot of them, and they're a phone call away. So, each person kind of has to know their limits, and they have to always be willing to call for help, to call for, the next step in the learning phase. And not everybody in it's not a straight up trajectory. We live in time, groups of time that other things kind of take priority. Because I can, in my 20s, when my children were small, I didn't have the time that I have now, to read and study and all of that. But I stayed relevant and was able to keep up with what I needed to be able to keep up with. And I've never lost that curiosity. And I think that when you look around at your peers, the important thing is to see the ones that are making the effort to stay abreast of what's current, because that is not easy to do. And I really think that once you get over a certain age, whatever that happens to be for each individual person. But when you start to think I'm heading for retirement, then the effort maybe isn't there in staying abreast of everything. And since I don't intend to retire, I don't see that coming. But I do understand why people switch courses and what have you. We just, as a community, need to be able to advocate for each other and support each other, and even support the parts of our healthcare system that may not be working 100%, but we support that because it's helping. We just need to all be taking steps forward together so that it's better for the patient at the end of it.
Well, and I do hear patients blaming providers a lot about what's happened. They're like, they don't care. They make money off of pharmaceutical companies. And to be clear, you can't make money off of pharmaceutical companies. They cannot pay you, but they do go in and they do luncheons and they do educate. And like Libby was saying, it's really hard for them to learn. So they're learning from the reps what drugs do and implementing new things in their office, but they're not making money off of it. They're not getting money for every referral or every drug that they're.
Yeah, no, that anti-kickback system kind of took care of that some time ago. But the problem is, because they're paid so little for the amount of quality time that they spend with patients, that we've kind of structured, even in nursing school, I see now, they structure everything around these algorithms, and it's if you have this, then you do this. And if you have this, you do this. And so much of the treatment is around pharmaceuticals because that's what treats the patient's symptoms. Because we haven't
think-
developed a good arsenal for figuring out the root cause, then we have to try to at least make people more comfortable. And we make them more comfortable by giving them symptom control. But that isn't necessarily for the long run the best option. I'll use any of that in the short run. And I tell patients honestly, if your blood pressure is crazy high, let's not talk about ignoring your blood pressure. We may need to do something short term, but let's figure out why it got to be that way. And let's see if we can't stop that process and turn it around. And we can. People just don't realize that. That's the difference. They think once they're on a pill, a blood pressure medicine, a bladder medicine, whatever, a pain pill, that they're stuck on it. And they aren't. But it might be a momentary measure till we can get to the root cause and get it handled.
But in Western medicine, that's what they see is they're on omeprazole for 20, 30 years. They're on high blood pressure meds for life. That's what they see in other clinics, and just the way that we've structured our medical system. And I agree with you with providers, they don't have time. They're not able to go in there and actually explore and actually be able to get to know your needs. And so they're going in, looking at a symptom, treating that symptom. So that's part of the reason why you're not getting taken off medication, is because they're going in there, they're fixing a problem, they're moving on. The next problem comes up, they go in, they fix the problem, they move on. But they're not looking at how all the problems may be correlated with each other. They don't have enough time to explore really what the root cause of what's going on. Some of these things are really complex. That's why they're specialists. But even those specialists, what they're learning is, again, prescriptions, treating symptoms, not
procedures, surgeries, and none of that is bad. I certainly don't want to put out that any part of that is bad, because it's not. Each of those things has its place. But I think overall what's happened is we've learned to depend on those things, and then we call it a cure. We call it good, and we're not even close. So I'd like to see us spend a little bit more time figuring out the deep-rooted problems, correcting those, because as we are living longer, the expense of caring for people that have cognitive problems, the expense for paying for people in nursing homes for all of these things, it's not free. We can look at how we spend our money, and we need to be spending our money on keeping people healthy rather than sustaining them past a point in time that for a lot of them, they may not even want to be here anymore. So, where person.
Exactly. I mean, what is our value? Where are we going to invest our money, and when? If we can do it early on, keep ourselves healthy, our memory there, our body well, then we don't have to invest in a nursing home. We don't have to be placed into that piece at the end of our life. That doesn't have to be our reality. And so many of us feel like that's just where we're going to be in the end.
Well, the joke in my mind is, in the car industry, they call it preventative maintenance. We need a little bit of that in human health care. We need, the 10,000 mile checkup, the 15,000 mile checkup. But these checkups need to be truly preventative checkups, not, oh, here, let's fix this problem or let's cover up this problem with a symptom control medication. But really and truly stop for a moment, see where we are, figure it out, and then step forward again. And I just think that will save tons of money on the back end, but more important than the money is the quality of life for each individual person.
Right. But isn't that a wellness exam, Larry, that you're talking?
Yes, that's what it's being sold as right now. But I'm telling you, the typical wellness exam is a joke. They are mandated to do, a colonoscopy at a certain age and a mammogram at a certain age. And, there are a few of those things thrown in, but they are the things that, from a cost standpoint, the insurers have been forced to provide. And they aren't looking at all even beyond that. Most of the patients that come into our clinic have never even had a thorough biochemical workup, a thorough lab panel. And it all comes down to cost, because the cost of our panel right now, if we ran it through one of the local insurers, it'd be about $3,000. It costs the patient $399 out of pocket for that same amount of information, 5 pages of test results. But those test results set a foundation because we're looking at all the hormones, we're looking at all the inflammatory titers. And those are so important as far as really being to figure out, is there a problem in the human homeostasis? Because if you wait until one of those, the metabolic panel or the complete blood count, if we wait until those get out of balance, a lot of times people are so ill that we're not going to turn the clock back as much as we could have if we had picked up the problem earlier.
Yeah, I hear that all the time from patients as I do my yearly wellness, everything is okay. They tell me all the time that my labs are perfect and I'm good. And then when they see our labs and we go through those things, then they're like, "Oh, this makes sense. These everything makes sense. All of that I've been feeling is reflecting on these preventative lab measures for one, is when we're looking at that, when you say out of range, they're already very sick, like you said.
Yeah, exactly.
The preventative piece is to look at where are they at in their ranges and where are we driving disease? And that's not what a wellness lab or disease prevention is in Western medicine or just in general with general providers, right? So I'm grateful we do that in our office. I'm grateful that we provide an explanation of each piece of what's going on, which can be overwhelming sometimes. But again, like Libby says, is she's trying to teach. And then over time, you get those things. You're like, oh, I remember you saying that. And I didn't know that that's what this meant. And then you can start taking charge. Even if you choose not to stay in our office, now you know what a CBC is, what its job is, what a CMP is, why do we want to watch these specific ranges? What do those ranges mean? And it's really valuable for you as a person to be able to take charge of your life outside of this office. And that is another thing that I'm proud that we do in this office.
Yeah, that's meaningful to me. I love it when patients come in and ask me tough questions. And I love it when they go to other offices and they challenge some of the beliefs and they can actually explain to the provider why something needs to be looked at differently. And most of the time, to give the providers credit, they actually will agree, because it's not that they don't know. A lot of them are they're stuck in a tough situation where they've got limited resources to work with, and patients have high expectations, or they have no expectations because they've kind of lost trust. Because how many people do you know won't even go to a physician's office anymore, or an annual checkup? So, I mean, like I said, we've done some harm. We've violated some trust, and we're going to have to build that back slowly over time. And that's not something I can do by myself. Everybody involved in taking care of people is going to have to be able to be willing to step forward and do that.
Agreed. And then patients advocating for themselves. You should advocate for yourself at any office that you're at. You should ask questions. That should be allowed. You should be allowed to know everything that they're prescribing and what it's for, and fully understand that. You shouldn't feel pressured. And that's the hard part, right? Is when you only have 15 minutes with a patient, or on the American average or the US average, 7 to 15 minutes, it's not a lot of time for them to tell you everything that's going on, for you to tell them what's going on, and then really thoroughly understand that. And then they have a patient flow. When you're calling into the nurse, there's so many patients, it's hard to get answers. So, push back a little bit from a patient's not a bad thing. Being able to tell your provider, take a second, I don't understand this, regardless of what office you're in, is important. And I think everybody should do that. And I'm proud of being able to do that here. Is when they're calling, they get an answer. We have a system where they can text. We have, we've implemented a structure to where they get those answers. And then we say it as many times as needed, because when you have memory decline or any brain fog, everything that we're talking about sometimes it's out the window the moment that you leave the office. And so we don't expect you to remember it, and we want you to come back and feel comfortable. And so I'm grateful that we've provided this. So Libby and I really, really, really worked on creating such a positive workflow for the staff, and also making a positive environment for patients to be able to be here and maybe try to reverse some of that medical trauma that they've experienced in other offices. And so just remember, advocate for yourself. And I'm so grateful for you guys tuning in with us today. We are so grateful to be able to start this podcast and be able to educate other providers and be able to be a resource for you to be able to advocate for yourself and learn new things that you could do to prevent disease in the future.
Thank you so much.